Best Practice Management Software of 2026. Welcome to part 1 of our 10-part series on the best healthcare software in 2026. In this episode, we're covering practice management software, the operational backbone of any medical practice. We'll look at the best platforms for small practices, mid-market healthcare organizations, and enterprise health systems, and how your specialty shapes the decision. Before we dive in, this video is sponsored by several healthcare software leaders, including our title sponsor, athenahealth, as well as our other sponsors and partners, NextGen, drchrono, CareCloud, and TotalMD. What a stellar group of platforms. You can learn more about each of them through the links in the description, and stick around to the end for more resources. Alright, let's dive in. Best practice management software for small practices. For small practices, solo providers, small group practices, or specialty clinics with fewer than 10 providers, practice management is often the first real administrative system they've ever had. They're moving off paper and spreadsheets, and the decision has to be right because changing systems later is painful. The best small practice management platforms make scheduling simple, easy appointment booking, automated reminders to reduce no-shows, and a calendar view that works well for front desk staff. Handle insurance verification automatically, real-time eligibility checks at the point of scheduling so you know before the patient arrives whether their coverage is active. Streamline billing and claims, clean claim submission, denial tracking, and patient payment collection in one place, ideally with integrated clearinghouse connections. Stay affordable. Small practices can't absorb enterprise software costs. Transparent per provider or per claim pricing that scales with the practice size. Offer patient portal access. Patients should be able to self-schedule, fill out intake forms, view statements, and pay balances online. Include reporting basics. Collections by payer, days in AR, denial rates, and appointment utilization. The numbers a practice owner checks weekly. Here are several practice management platforms consistently chosen by smaller practices. Note, these are listed alphabetically. You can see the platforms on the left with notable callouts on the right. I won't read through every single one because we have a lot more to cover, but I recommend taking a screenshot and returning to this list later, then setting up demos to see them in action. There are also links in the description where you can get a much more detailed breakdown feature by feature in the SelectHub platform, as well as compare analyst scores. There you go, some of the best practice management software options for small practices. Before we move on, a quick shout out to our title sponsor, athenahealth. Unlike systems that bolt together separate modules, athenahealth, whose Athena One solution provides EHR, practice management, and revenue cycle management, serves medical practices and health systems in one unified system. Their single instance network of over 170,000 clinicians and 117 million patients gives them a scale that's hard to match in ambulatory care. Plus, Athena One is AI native from the ground up. The platform brings AI into the workflows that power ambulatory care, helping practices deliver care, manage revenue, engage patients, and run more consistent day-to-day operations through one connected platform. Thanks to athenahealth for supporting this series. Check them out through the link in the description to see if Athena One is the right fit for your organization. Now, back to the show. Best practice management software for mid-market organizations. Mid-market healthcare organizations, multi-site group practices, regional health systems, and specialty networks with multiple providers across multiple locations need practice management software that handles operational complexity without requiring a dedicated IT team at every site. Mid-market practice management buyers typically look for multi-location management, centralized scheduling, billing, and reporting across locations with the ability to manage each site locally while maintaining org visibility, advanced revenue cycle management, claim scrubbing, payment posting, automated denial management, and AR analytics that go beyond basic billing into revenue optimization, provider credentialing integration, automated tracking of provider licenses, DEA certificates, and payer credentialing status, because gaps here directly impact billing, scheduling sophistication, template-based scheduling by provider and location, waitlist management, and automated patient recall for preventative care, reporting and analytics, revenue by provider and location, payer mix analysis, no-show rates, and operational metrics that help admins better manage the organization. Here are several platforms often chosen by mid-market healthcare organizations. Again, screenshot this list, and there are also links in the description where you can get a much more detailed breakdown feature by feature in the SelectHub platform, as well as compare analyst scores. Our analysts have reviewed popular practice management platforms in depth and ranked them with scores based on a myriad of factors like features and integrations. So, if you're in the market, you definitely don't want to miss out on these side-by-side comparisons. Links to the SelectHub platform in the description. Best practice management software for enterprise health systems. At the enterprise level, like large health systems, academic medical centers, and multi-specialty networks with hundreds of providers, practice management becomes integrated infrastructure that spans clinical, financial, and operational functions simultaneously. Enterprise practice management platforms need to support enterprise-scale revenue cycle management, end-to-end RCM from pre-authorization through final payment, with sophisticated denial prevention, contract management, and payer analytics across thousands of claims daily. Health system integration, bidirectional data flow with the EHR, the hospital information system, the credentialing system, and financial systems, without custom integration projects for each connection. Population level scheduling, capacity management across the enterprise, resource utilization analytics, and demand forecasting that optimizes provider and facility utilization, compliance and audit readiness, HIPAA compliant data handling, audit trails for every financial transaction, and reporting that satisfies regulatory and accreditation requirements. Configurable workflows. Enterprise health systems have unique processes. The platform must accommodate custom workflows without requiring expensive customizations every time. Here are several platforms consistently chosen by large health systems. Screenshot this list and dive into the links for SelectHub's feature-by-feature comparisons. Our analysts have reviewed popular enterprise healthcare platforms in depth. Links to the SelectHub platform are in the description. There you have it, an overview of the best practice management software in 2026, from small practices through enterprise health systems. One more big thank you to the sponsors who made this series possible, including our title sponsor athenahealth, as well as our other sponsors and partners, NextGen, drchrono, CareCloud, and TotalMD. Each of these brings unique value depending on your organization's size, specialty, and operational needs. To book demos and for more healthcare software resources, including pricing guides and SelectHub's database of feature comparisons, check out the links in the description. I'm Devin Hennig with SelectHub. Thanks for watching, and we'll see you next time. Cheers!